Hello, how's everybody doing? My name is Jean-Jacques. For those of you guys that does not know who I am, and I am in the real estate, health insurance, and finance industry. So guys, listen, I do want to thank you, and I do appreciate you guys for everything that you guys have been doing, which is supporting the channel, supporting me, supporting my work, supporting what I do, supporting the information that I bring to you guys. And I'm really thankful about that. And the other thing is, thanks for those of you guys that have been watching but haven't subscribed yet. Sooner than later, I know you'll subscribe. Thank you for that. I do appreciate you all. I do appreciate everyone. Today, what I have to bring on the table, and don't forget, guys, to comment down below, all right, and give me a thumbs up. Today, what I have to bring for you guys with regards to information is with regards to Medicare. What is Medicare? So pretty much Medicare is health insurance. It's health insurance for the seniors at the age of 65 or a little bit older, or for folks that are disabled that is deemed qualified to be on Medicare. How do you get Medicare, or how are you qualified for Medicare? Like I said, number one, you would have to be 65 or older, or to be disabled to be able to get Medicare. Now, what are some of the things which is some of the questions that some folks have been asking me is, what would cause someone to not get, Medicare or full Medicare, or how does it actually work, and all this good stuff, which is all great questions, guys. But I would love if, you guys comment down below and ask those questions, so, that kind of engage other folks to actually come out and ask the questions that's also on their mind. So number one is, you have to work full-time for 10 years. Or you work for 40 quarters, meaning that you have to put in that time for Medicare so that you'll be eligible for Part A and B. Part A and B is also, Medicare is divided into those categories. Part A, B, and C. Part A is your hospitalization. Part B is for your outpatient, your regular doctor visits and things of that nature. Part C is, of course, A and B and C, which combines, which also gives you your drug plans. When I say drug plans, I don't mean, nothing illegal. Stop it. Don't think like that. I know you guys are not. I'm just trying to make a little joke. Meaning that your prescriptions that your doctor is providing to you, legally, of course. So, guys, here's the thing. How do you deal with Medicare? Medicare is just that, and, is it just, okay, I have Medicare and I don't need anything else? So, yes and no. If you really think about it, yes and no. When I say need, meaning that something you cannot live without. So when you have Medicare Part A and B, you need a supplement that comes along with it, meaning that you need another plan to go along with that. So we have Medicare Part A and B, then you need to make it into a Part C, getting into either an Advantage plan or a supplement plan, whichever one works for you. Every case is different. Not every case is the same. The thing is with Medicare, not every plan is also the same. We're not going to get into plans or discuss any kind of pricing or anything like that. That's not what this video is for. But if there is any information that needs or any questions that you have, personal questions that you would like for me to answer for you, you can comment down below and I'll respond, or whichever way that we could go about it of a means of communications, so we could get it going, so you can get your questions answered. Those plans that I'm talking about, they kind of help and cover you and shield and shelter you. Yes, you have A and B, so now you need, of course, your drug plans and everything else. So now you got to think about, okay, you know what, then I need to deal and talk to somebody that can help me to navigate, dealing with Medicare. Don't forget, Medicare is one complicated subject. It is not easy to deal with. It is not easy to just say, okay, you know what, I read a book and understand Medicare. No, and it changes every so often. So it's not just one, how to call it, one cut and that's it, or one whatever, one shoe fits all, any kind of those slogans. So Medicare is a very complex situation to deal with, very complex healthcare to deal with. And especially, if somebody is disabled and there's a lot of complications, if somebody is on a lot of medication, that, it's not easy like that to just deal with Medicare. And with that alone, and just because, just if you guys remember before, I said that if someone is disabled, they could also get Medicare. It's not just like that neither. There's a waiting period for that. So guys, listen. Don't forget, comment down below. If you have any questions with regards to Medicare, if you feel like I'll be a good source, a good avenue for you to reach out to so you can get some questions answered. I'll be more than happy to answer those questions for you. Other than that, listen, I'm going to let you guys go with that thought. Don't forget to subscribe to the channel, comments down below, and give me a thumbs up, and I'll speak to you guys soon.